Hello and welcome back. In this lecture, we're going to be discussing DSM-5 V codes or Z codes. These are really influential codes because they help create the clinical picture for the client outside of just the clinical diagnosis. Right? There's clinical use to it, and we're going to discuss certain categories and practical examples of these V codes. Because in your signature assignment, you're going to be assigned to actually not only find the DSM-5 diagnosis and justify it and find differential diagnosis, but you're also going to have to be able to identify B codes or Z codes that meet to help create a bigger clinical picture for the client. So the definition of a V code is conditions that may be a focus of clinical attention but are not mental disorders. So things like finances or issues in relationships or issues with family or issues with reading or issues with child to parent child to parent relationships. All those things are there V codes to help create that clinical picture to help the reader actually see what are some additional circumstances that lead into the disorder, right? So they're found in section 2 of the DSM-5. They correspond to Z codes in the ICD-10 CM. And they use to document psychosocial and contextual factors affecting mental health. So why do we use VCOs, right? They create that clinical picture, right? They help us get a bigger clinical picture than just the diagnosis. For instance, if a client has bipolar disorder, of course we know there's issues with mood and depression and probably anxiety and impulsivity. But are there some other circumstances that play in the client's life that tend to lead into that disorder? They're also important for treatment planning and risk assessment and case formulation. Can justify services or interventions even with no formal disorder and diagnosed. And they're relevant for insurance documentation, especially for Medicaid and Medicare. Here's some common categories of VCOs, like relational problems, parent-child relationship relational problem. And you can see that Z code is Z62.820. Relationship distress with spouse or partner, that's Z63.0. Those codes there are ICD-10 codes. And remember, when they're put in, they help insurance companies and they help people that utilize the codes and whatnot identify what the area or issue is, right? So abuse and neglect. We have child emotional abuse or adult physical abuse suspected, right? Housing and economic problems, homelessness and extreme poverty. Do you have educational or occupational problems, academic or educational problems, or unemployment? So other psychosocial environmental problems, discord with neighbors or community, acculturation difficulty, legal problems, problem related to crime or imprisonment, medical treatment compliance, non-adherence to medical treatment. Again, these will go under the DSM-5 mental health disorder code and title, and then you'll have these V codes that follow under it that help to actually create more of a clinical picture. So here are some of the features of the V codes versus the DSM-5 diagnosis. Is that a mental health disorder? No, it is not. Right? The DSM-5 diagnosis is. Is it billable on its own? On its own, sometimes with justification, but rarely are they billable. Right? DSM-5 diagnosis. Usually they are billable. Requires full criteria. No, the Z codes do not require full criteria. They just again help create that clinical picture. But the DSM-5 diagnosis does require full criteria. The clinical use is contextual factors, and for DSM-5 diagnosis and treatment guidance. So here's an example of how this would look. Of course, this is Miss Peggy that we have for our anxiety disorder, right? We diagnosed her with generalized anxiety. That is the DSM-5 code. I'm sorry that I'm missing the ICD-10 code, but that will go first with the ICD-10 code, and then you will see below it the Z codes that follow it, right? Because now you see she had relationship stress with spouse, low income, and educational problems, right? And the V codes enrich clinical documentation to help paint a full clinical picture, right? Again, just seeing that generalized anxiety disorder does not create that full clinical picture, but adding the Z codes and V codes to it actually play a huge role in creating more of a clinical picture for the client in other areas that they may be struggling with. Case management and other resources will see these things and know which areas they need to help out with. So tips for using V codes. Use them to document relevant psychosocial stressors. Always list them after the primary diagnosis. Again, they go after, not before, after the diagnosis. Use clinical judgment. Ask, is this factor impacting the client's mental health or treatment? And be aware of coding or risk factors, right? History of abuse or neglect.